doing a vlog on recovery from cervical disc replacement surgery. I had two levels, C4-5, C5, C6. I had them done with Atlantic Spine in West Orange, New Jersey. This is now currently, I am a week and a day out of surgery. Today was the first day I switched to a large bandage. I know they say don't touch the bandage. Unfortunately, mine keeps peeling off and or looks really odd. So I would wash my hands very thoroughly, put alcohol on them, get a sterile bandage, and then to get the same transport type covering they would use. That got difficult. I did figure it out. If you are in a bind and have to replace it yourself, we often think about being square to our body or square to the position. So I would, have it level to the floor, and it would always just get on my neck wrong. I then started just following the contour of my chin for the bandage. This is not this one, the other one I was doing that I showed in other vlogs, and it would definitely go on a little bit more appropriately. I think I could do the same thing, and I probably should do the same thing with these bandages. What I end up doing is I end up taking a shower and I have peel off, so I just peel them off all the way, carefully remove them from my skin. I mentioned that in the first or second time I removed it, I pulled it off aggressively without it being wet, and it damaged my skin a little bit. Not the suture, but the skin around it. And obviously, if you can't, the skin around it is damaged, it makes it very difficult to put a bandage on. As far as activities go, I'm still doing a lot of cardio. If I was not a member of a gym, I would join the closest large, quote unquote, Globo gym around, because you're going to be 6 weeks without really being able to be too active in any like home gym type activities, or let's say you have your own, squat rack in your basement and dumbbells. Today I used a step mill. Lately I've been using the treadmill on a significant incline. It's a great cardiovascular workout, not too exertional. I think the whole thing is they don't want you to, be running too hard, to be too exertional where you're putting a lot of pressure, bearing down Valsalva type maneuvers, putting pressure on the neck, tearing the sutures open. Obviously could be a problem. So I used the step mill, which worked out really well. Today and tomorrow I'm looking forward to going back in there and using the treadmill. Honestly, this 2-week recovery where I'm out of work has been an exercise in trying to not be bored. I've watched a lot of Netflix. I've watched a few movies. I've completed building an engine, a small engine that's like a hobbyist would build. I've done a lot of things, read a few books. Took a bunch of continuing education courses last week when I was really not able to move too much at all. So just plan on, taking it easy. I did try to go to work today. I lasted about 3 hours. I felt, although I'm talking now, I felt having to talk constantly 4 to 3 hours, kind of what I do for my living. I kind of oversee things and talk to people about the care of others. Got a bit exhausting towards the end. A couple of people did mention I was kind of getting very, very hoarse and clearing my throat a lot. And I also felt a big strain across the suture line. I was just trying to talk loudly. We were in a meeting, and I was just trying to just mention a few things before I left, and I started feeling it. So I could see sitting in a desk job being a little bit easier to get back to quicker, especially if you don't have to talk a lot or communicate a lot verbally. Certainly could make a big difference. My job is pretty physical as a whole, chiropractically and adjusting people. So, working with people in a gym, I think that stuff's going to have to wait a little bit longer. I think next week I'll be going in a lot, just doing a lot of paperwork, just making sure the quality care is there. I don't know how much talking I'll be able to do, because after a while it gets hard. I did feel a little bit tired after about 3 hours as well. Any other changes going on I can't really think of off the top of my head, other than the changing of the dressing. I will say, as far as soreness of the throat with swallowing, That was very difficult through the middle of last week. I think the true discomfort, kind of like you have a cold or discomfort, swelling overall, lasted till about yesterday. Yes, it wasn't much of anything. It just kind of felt like you had a cold, like you were about to have a cold or getting a cold. But today seems to be completely fine, and that made me realize that maybe that was, the recovery process. I thought maybe I was maybe coming down with a cold. I did a couple at-home rapid COVID tests. Nothing like that. But then I realized today I just feel great. So as far as swallowing and eating and stuff like that, but it's still again difficult to talk completely. I'll probably do another one of these vlogs at about the 2-week mark, unless something significant changes between now and the 2-week mark that I should go over. I think the biggest challenge I'm having is trying to avoid looking up. Again, I think I talked about this already. With progressive lenses, you tend to tip your head back to use the bottom half of the lens to read. I've been using just readers a lot. I strongly recommend that if you have progressives and you don't have a set of readers, especially if you're gonna be bored and probably be reading a lot and staring at your computer a lot, go to like a local pharmacy and just get a cheap pair of readers. That are, the whole lens is the prescription. I definitely catching myself a lot, tipping my head back to the point where yesterday, I was just walking around with the readers on top of my head, whole lens reader, and dropping them down when I need to read, and not using these. I actually grabbed these today because I went to work. But I would definitely, as far as preparing ahead of time, that would be something I would definitely look into. I think that would be very helpful for you. All right, thanks.